Having a skincare calendar will make it easy for you to follow your skincare routine because now you know which ingredient or which product goes when. Hi, this is Dr. Priyanka Reddy, and in today's video, I am going to set up your skincare calendar based on your skin type. So firstly, let's start off with a skincare calendar for oily acne-prone skin. Now, if you have concerns of blackheads, whiteheads, or we call it as open comedones, closed comedones, mild acne, or if you feel your face is getting oilier or shinier, even after 2 to 3 hours after face wash, this calendar is for you. So the most important factor we consider when we treat oily acne-prone skin is the oil, that is the sebum. Now we want to control the excess oil that is there on the face and exfoliate the dead skin cells that are getting accumulated. These are the most important things I look at when I treat oily acne-prone skin. So what are the ingredients we need for it? Now, everybody needs basic ingredients like a face wash, moisturizer, and sunscreen. Yes, you heard me right. Even oily acne-prone skin will need a moisturizer in a skincare routine because excess oil is not equal to a well-hydrated skin. Oils are different from hydration. So, the three basic products: your face wash, moisturizer, and sunscreen. Now with oily acne prone skin, there are two different face washes you need to look at, one for the morning and one for the evening. Why? Because morning you want something that is very nourishing, doesn't dry your skin out and just wakes your skin up. But for evening, you need a face wash that will help you take away the excess oils, dirt and grim that is settling on your oily skin. Next, salicylic acid. Why? Because this is a beta hydroxy acid that can go deep into the skin, clear up the excess sebum, exfoliate the dead skin cells, reduce the inflammation. I can keep going on how important salicylic acid is in their skincare routine for everyone, especially for people having oily acne-prone skin. So how do we include this in your skincare routine? One is in your evening face wash, a 2% salicylic acid face wash, using it every day or once in 2 to 3 days, depending on how oily your skin is, will help in tackling the sebum and dead skin cells. We also put it in your chemical exfoliant. Now, chemical exfoliation becomes a very important step for improving the oily acne-prone skin. Now, how do you use it? Use chemical exfoliant 1 to 2 times in a week. Start slow and gradually progress. You would not need it for more than twice in a week, but sometimes depending on your environmental exposures, you can make it 3 times a week, but definitely not more than that. If you're using more than that, you're making your skin more sensitive and inviting more problems. So chemical exfoliation 1 to 2 times a week, maybe 3 times a week sometimes. So we have your face wash, moisturizer, sunscreen, chemical exfoliant. Now, the other important ingredient in your routine is a retinol or a retinoid, depending on the severity of your acne. Now, this again is supposed to be used once or twice a week, not more than that. You can gradually work your way up to using 3 times a week depending on your age. But if you're an younger individual targeting only the acne, 2 times a week is good enough. Now, what sort of retinol or a retinoid you will need will be told to you by your dermatologist, so please consult one. Now, we have these 5 important products in your routine. Now, do we need anything more? Yes, if you have pigmentation that has come because of your acne, or if you have a skin type that is prone to pigmentation, you will also need some ingredients that work directly on your pigmentation. Now, all of these also work on your pigmentation indirectly, but you will need some products which will have ingredients like azelaic acid, alpha-arbutin, niacinamide, kojic acid, resorcinol that will help in reducing your pigmentation. So look at the skin calendar to know how you can include all of these into your skincare routine, which will help making your skincare routine effective, safe. One more important point with your moisturizers is that though you have an oily acne-prone skin, your skin might feel different on different days. So it's always good to have 2 different types of moisturizers. One, a very lightweight water-based moisturizer that will help in protecting your skin barrier, nourishing your skin without clogging your pores, right? And you also would want to have another moisturizer that is slightly thicker or cream based on the days where your skin feels dry. And what sort of sunscreen you must be choosing? Without doubt, a water-based, extremely lightweight, non-comedogenic sunscreen that offers broad spectrum protection. So sunscreen, moisturizer, face wash every day, chemical exfoliation 2 times a week, retinol or retinoid 2 times a week, alternating it with the chemical exfoliation and definitely not on the same day, and using depigmenting ingredients every day if there is a need for it. So when it comes to chemical exfoliation, you can do it in the daytime if you do not have direct sun exposure. But if you do have a lot of sun exposure, you can put it in your PM routine. Retinol and retinoid definitely only at night. And make sure you do not forget using your sunscreen after you chemical exfoliate, and especially after you use your retinols or retinoid. Never step out without your sunscreen after you do chemical exfoliation and using retinol. Well, this is about the skin calendar for oily acne prone skin. Let's do the skin calendar for dry skin in the next video, as this has already gotten lengthy. If you have any more questions on this, please put them in the comments. And do share the video with all your friends having oily acne prone skin.